It's a tick! It's a tick! Don't let him get me! Oh, I'm scared of ticks! Help me! Have me! Well, it happens to be that Lyme disease, and remember, Lyme with an L-Y, not an L-I. Limes are with an L-I are things that you make pie out of or put in the top of your Corona beer. Lyme with an L-Y is the name of a place in Connecticut, Lyme, Connecticut. People are scared of Lyme disease like you wouldn't believe, but the issue is that Lyme disease is a very unusual disease. 10 or 15,000 cases of disease a year. Virtually no one has ever died of it. So 10 or 15,000 cases of disease of a virtually non-fatal disease. You're more at risk of dying in an elevator crash than you are from ticks and Lyme disease. So nevertheless, it's a very small knowledge base. Ready? The first thing that happens is you get a Lyme rash. That's 90% of people will develop a rash. Now, from that, you can get certain things. Joint manifestations happens in 60% of untreated Lyme. It's a little bit like syphilis. Why do we treat the chancre? Well, we treat the chancre so you don't get neurosyphilis 20 years later and 10 years later. Don't get a rash a month later. Why do we treat the chancre? So that you don't get demented and get Argyle Robertson pupil and Tabes dorsalis. Why is it that we treat the Lyme? Well, because the rash will go away. We just don't want to get the joint manifestations, deforming arthritis. Now, the other long-term manifestations are neurological Lyme disease. Now, you can get meningitis, encephalitis, peripheral neuropathy. You can get any neurological abnormality, but the most common neurological abnormality is a seventh cranial nerve palsy. And what's unique about it is that the seventh cranial nerve palsy can be bilateral. Go up to Westchester each year. For 2 months of the year, no one face moves. Hey, how are you? Oh, hey, what are you doing? Oh, okay. Oh, real. Well, bilateral palsy. You don't seem to like me. Why do you say that? Well, seventh cranial nerve palsy, bilateral, very unusual. Sarcoidosis, Lyme disease. Sarcoidosis, Lyme disease. Now, the last manifestation is cardiac. Cardiac Lyme disease is also very rare. You can get pericarditis, you can get endocarditis, you can get myocarditis, but the most common manifestation of Lyme carditis is AV block. AV block. Now, you don't have to have the joint to have the neuro. You don't have to have the neuro to have the cardiac. You could have the rash and then get any one of these. Most common cardiac, AV block. Most common neuro, seventh cranial nerve palsy. Joint is the most common of the long-term manifestations. Now, if you have a person who has a Lyme rash equals Lyme. Equals go straight to treatment with either amoxicillin or doxycycline. You do not need to do serology. You do not need to do blood testing. You do not need to do ELISA and Western blots. On the other hand, joint manifestations can be from many things. You should do serology before you determine that the person needs doxycycline. Why? Because there are a lot of things that cause joint pains. If you have a seventh cranial nerve palsy, there are lots of things that cause seventh cranial nerve palsies. You should do a serology to make sure it's the Lyme causing your seventh cranial nerve palsy. Now, these three things, the Lyme rash, the joint, and the facial. The rash, the joint, and the facial can be treated with oral antibiotics, doxycycline or amoxicillin. The other long-term manifestations, such as the cardiac manifestation and all of the other neurological manifestations, these things need intravenous ceftriaxone. Cardiac and the other forms of neurological problems. Now, these more minor things, the rash, the joint, and the facial, the rash, the joint, and the facial can be treated with oral doxycycline or amoxicillin. More serious manifestations, meningitis, encephalitis, cardiac abnormalities, IV ceftriaxone. Minor things, oral. A Lyme rash equals Lyme. A Lyme rash equals Lyme. So therefore, if you have a Lyme rash, it has greater specificity than actually the Lyme serology. Borrelia burgdorferi, the serology is not an excellent serology. The Borrelia burgdorferi serology has less sensitivity than the Lyme rash, less accuracy than the Lyme rash itself. Now, let's look at a couple of little special things here. If you have a 26-year-old woman comes to your office on Monday morning and she's got a tick attached to her buttocks. She has no symptoms, but she has an otherwise asymptomatic tick bite. What would you do for this woman? Would you do A, nothing, B, serology, C, doxycycline, E, amoxicillin. Last one, send the tick for analysis. What would you do? You have an asymptomatic chick with a tick. And the answer is do nothing. Asymptomatic tick bites. Your answer is do nothing. Your answer is do nothing. Now, there is no point in doing the serology because a serology without symptoms is not relevant. The specificity of serology is very poor. Therefore, if you have no clinical manifestations, but you have a serology that's positive, it doesn't mean anything. Do nothing. Now, let's look at a couple of these pictures here. Now, the target rash of Lyme, red on the outside, pale on the inside, red on the outside, pale on the inside, is characteristic of Lyme. Red on the outside, pale on the inside, go straight to amoxicillin or doxycycline. Amoxicillin or doxycycline. An Ixodes tick, oh, isn't he cute? Well, that's a blade of grass. That's a blade of glass. This guy is the size of the point of a head of a pencil. Small, small, small. Now, of course, the one that always gets the most attention is the engorged nymph. An engorged nymph always receives the most amount of attention. Repeat after me. An engorged nymph always receives the largest amount of attention. What do you do about asymptomatic tick bite? Do nothing. Do nothing. Greetings, friends, and welcome back to Ticks R Us, our fireside chat with our local friends, the tick. Now, you may have noticed in our recent case, we asked you to describe what you would do for a patient who had an asymptomatic tick bite, and would hear with our friend, Mr. Scapularis. Now, is it true, Mr. Scapularis, that your name used to be Damini?
Oh, yes, I used to be called Damini, but I didn't like the word, so I changed it to Ixodes scapularis.
Yes. Now, can you tell me, why is it that you feel compelled to bite people on the ankles when they walk by?
Well, I was just hanging out on a blade of grass, and I couldn't help myself. Those ankles, they look so juicy, I couldn't help it. I have to jump, I have to bite. Oh.
Well, you know, a lot of people have said that when you bite someone and there's no symptoms, that perhaps we should send all the ticks for analysis. Do you think that we should ever answer when the person has an asymptomatic tick bite, should we put all of the ticks into analysis? And ask them why they do that. Should we put you into analysis?
No, but when I was a nymph, I got a lot of attention, and then I became an adult and no one paid attention to me. But I don't think there's any point in putting me through analysis.
So then the answer for putting the tick through analysis is, sending the tick for routine analysis is always wrong. Yes, that is correct. Sending a tick for routine analysis is always wrong. And that is the end of Lyme disease.